Okay, so we all know that exercise is good for you, right? Right. But can too much exercise be harmful? Can too much exercise actually be bad for you? We all have anticipated that yes, if you do a lot of exercise, you're at a higher risk of getting injuries, for example, right? But today I want to discuss with you some new findings that some investigators found, and they were published in the journal Heart. Okay, so let's go to the webpage of the journal Heart, which is part of the British Medical Journal associated papers, and we're gonna take a look at the two articles that were just published. Okay, and in the first one, basically they studied a lot of patients, more than 1,000 patients. Okay, and these patients all had something called coronary heart disease. Essentially, they have had heart attacks in the past, or something similar than heart attacks. Essentially, they had a lot of cholesterol in their arteries, and they had problems in the past, and they followed them, and they analyzed their levels of physical activity. Okay, so surprisingly, people that actually didn't do any physical activity, as expected, they had worse outcomes. Okay, they had more heart attacks, and they die more of heart problems, in the future as they were followed. However, people that were also doing a lot of exercise also, where their high levels of activity were associated with also, worse outcomes. They were also having heart attacks, and they were also dying from heart disease. Okay, so this is important because even though some strenuous levels of physical activity had been previously associated with worse outcomes, this is a study with more than 1,000 patients that is very robust and published in a very good journal. So that was somewhat surprisingly that people that were exercising a lot were having also bad outcomes. Okay, and in the next article also they follow a lot of people. Okay, and in this was a Swedish article in which essentially more than 4,000 people were followed. Okay, and also people that were doing a lot of exercise, they found that they had a higher risk of something called atrial fibrillation. Okay, and atrial fibrillation is essentially that the heart starts beating very fast and without control. These surprisingly, high levels of activity were also associated with that. And then in the editorial, which is the editors just basically discussing these findings, essentially they just think that, people that are doing too much exercise, they're stressing their body a lot, and of course the heart is gonna suffer with that. Okay, so, well, these findings are basically intriguing at this point, okay, but the take-home message really is just that these are just intriguing findings. Now, for most of the people, basically, we need to continue exercising because most of us, we don't really exercise at the very, high levels. And for those of you that do, for those of you that run marathons, triathlons, Ironmans, you said this is just a word of caution, in which, if you're doing it a very intensive exercise, then just talk to your doctor. Just make sure that you're talking to your doctor and see, what the risks can be of doing very high intensity exercise. Okay, and in particular for those people that have had heart attacks in the past, like if you are listening, if you have had a heart attack, or if your dad or your uncle or your aunt, they're all there and they have had heart attacks in the past, and now they're exercising, marathons, and they're exercising every day 2 hours a day. Well, that may not be the wisest thing that they can do. Okay, and they definitely need to be followed up by a physician and follow up their counsel in regards to very strenuous exercise. Okay, well, this is just food for thought. In the meantime, just keep up the good work exercising, actually, which is good for all of us. And stay tuned. This was Dr. Ariel Lopez. I'm the editor-in-chief of Healthy News by One World, One Health. Thank you so much for listening, and please stay tuned.